Stem cells for stroke recovery, a new hope for healing. Hi, I'm Josh with DreamBody Clinic, and we're here in Puerto Vallarta. I've been helping a lot of people with stem cell therapies for over 8 years, and a lot of those patients have been because of stroke recovery. We do a specialized treatment for stroke recovery called the intrathecal injection. This is where we go into the lower back with this pretty long, skinny needle, and we're able to go into the thecal sac. That's the sac around the spinal cord that protects it and provides all of the spinal cord fluid and keeps it in there. So by going into this area, we're able to take out 2 milliliters of spinal cord fluid and put in 2 milliliters of what's called sodium lactate with mesenchymal stem cells. We have 50 million stem cells in this application, and that allows the cells to go up the spinal cord fluid to the cerebrospinal fluid, get to the brain, and start healing damage. There's been some awesome studies on this actually that have shown that patients that are able to get a treatment like this within 1 year of having a stroke, typically in these studies at least, we're seeing over a 90% chance of full recovery. And that's incredible. And it's also what we've seen with our treatments. Patients where you'll see is maybe partial face paralysis, sort of like Bell's palsy, or you'll see maybe their arm starts losing function and paralysis, or you'll see speech impediments or even lack of speech, all kinds of different things that can factor into having a stroke and if you recover from that. So if you get this treatment within a year, very, very high chance of success. But we've also had patients that did it years after a stroke and still saw improvements. So if you're in the United States, they don't give you a lot of options. Maybe they'll put you on some aspirin or a blood thinner and just hope it doesn't happen again. We have a way to actually treat the effects. So these cells will get up to the brain and then they start targeting inflammation. When you have a stroke, there can be damage left behind. There can be maybe dried blood in the area. There can be lots of damage. The stem cells will interact with the specialized immune system in the brain. It's mostly what are called glial cells. These are specialized macrophages, and their job is to clear out waste. So in the brain, you're sitting there in a bath of liquid. It's almost floating. You need to be able to get things to these areas that can be damaged. It's a big neural network. It's like a giant electrical system, and if something's in the way of these electrical connections, you're not going to get the correct communication, and that's going to cause problems. So with these specialized macrophages getting in there, they can remove that waste. Maybe there's some dried blood from the stroke left over, maybe there's some damage from where things occurred there, and it can help clear that out. They'll also help with what's called neovascularization. That's new blood, new formation of blood vessels, and you need to be able to get blood to the right areas to heal properly. So it can help reroute, get blood to the right areas. It'll also help with neurogenesis, which is new blood or new brain cell formation. And this is huge because if you've got damage there, you need to be able to repair it. In the past, we used to think that the brain couldn't adapt, couldn't grow, couldn't get, you couldn't teach an old dog new tricks, but that's not true. They found that it is aplastic, it can adapt to these things, and when you put the stem cells in there, that's like having more managers on the site. And as we all know, if you don't, you can have all the workers you want, but if you don't have good management, typically the job won't get done. So by getting these stem cells up there, they work via the paracrine effect, the signals they send out, the communication, they can guide that reconstruction process and get you feeling good again. We also have another medication called Cerebrolysin. This is a group of 14 peptides that are small enough to cross the blood-brain barrier. This is a medication that was actually created in Austria, and it's been approved in Europe for decades, and most of the rest of the world, just for whatever reason, the US, UK, Canada never really adopted it. And you can also get that while you're here, added on to the treatment. You inject it once a day for 20 days, and that can also help a lot with speeding up the process, because when you have the peptides on site, that's like having more workers. So now you got more workers, you got more management with the stem cells there, you're gonna get faster reconstruction. You're gonna heal the brain faster. We've just found that combo to work incredibly well. And fortunately, it's your legal right to seek medical treatment abroad and return home to the US with 50 dose units. to places like Europe or to Canada with a 90-day supply. So we provide all of the paperwork so you can go home legally, and you can do the stem cells here, start on the recovery there, and then when you get home, start injecting the cerebrolysin to continue that and just get an amazing outcome. We have lots of patient testimonials on the website. If you go to www.dreambody.clinic, scroll down on the homepage, you'll see the stroke recovery page. You can click on that. It's got all the info, testimonials from patients, links to studies, link to that study I mentioned with the very high success rate if done within a year, and prices, tons of info there. And you can always call us toll free at 888-704-3977. I'm Josh, happy to help.